According to the Center for Disease Control, heart disease is the leading cause of death in the U.S. Risk factors for heart disease include high blood pressure, high cholesterol, poor diet, and physical inactivity. But did you know how well you sleep may contribute to risk factors like weight gain? Or that heart disease often coincides with a sleep disorder like sleep apnea?
If you look at patients with hypertension, there's a very high prevalence of sleep apnea, somewhere around 50%. If you look at patients with coronary artery disease or cardiovascular disease in general, it's probably about 30%. And if you look at patients with atrial fibrillation, which is a very common heart arrhythmia, the prevalence is higher, probably about 50%.
Sleep apnea is a known cause of high blood pressure and irregular heart rhythm. We spoke with leading sleep specialist Dr. Matthew Epstein to answer the top questions about heart and sleep.
Well, over the last decade or so, there have been a growing number of studies looking at how sleep disorders affect heart health. And it's been shown that untreated sleep apnea in particular has a very profound impact on a variety of different aspects of cardiovascular disease. And this ranges from adverse effects on blood pressure, consequences related to coronary artery disease leading to myocardial infarction or a heart attack, to various cardiac arrhythmias, to congestive heart failure or weakening of the heart function. Treating sleep apnea has a number of benefits for patients with underlying heart disease. For patients with hypertension, treating sleep apnea often leads to an improvement in blood pressure control and often a reduction in the amount of medication required to treat the hypertension. For patients with coronary artery disease, we know that sleep apnea can make things worse, and if you treat underlying sleep apnea, this can help prevent progression of already established coronary artery disease. For patients who have cardiac arrhythmias, treating sleep apnea can be very important in helping get the arrhythmias under control. And for patients with weakened heart muscles, a condition known as cardiomyopathy or congestive heart failure, treating sleep apnea often leads to a significant improvement in cardiac function. If you think about what happens during the night when a patient suffers from sleep apnea, their body is undergoing a great deal of stress. It's almost like they're undergoing a stress test. So they fall asleep and their air passage in the back of their throat narrows and then collapses. And this occurs for anywhere from 10 seconds to 20 seconds and beyond. While this is occurring, they're trying to breathe, and it's as if someone were choking them, but it's all happening internally. So they're expending a lot of effort to breathe. They're expending more and more effort to breathe beyond this obstruction or blockage in their airway. And while this is occurring, their body is putting out stress hormones, or what we call catecholamines, which lead to an increase in heart rate and blood pressure. At the same time, because they're not able to breathe, their oxygen level in their blood is dropping, and this puts an additional strain on the vital organs such as the heart and the brain. So when we measure different parameters while patients are having apnea during their sleep, we find that the heart rate is up, they become tachycardic, their blood pressure skyrockets, there are surges of these stress hormones, and all of these changes lead to the end consequences, including hypertension, coronary artery disease, stroke, etc. There were a couple of interesting studies that were done through the Mayo Clinic, which showed that patients with sleep apnea have a much higher incidence of having a heart attack during their sleep. The Mayo Clinic also performed a second study showing that patients with sleep apnea are much more likely to die during their sleep. Sleep apnea can really affect anyone. Sleep apnea can affect children, it can affect young adults, but the majority of those affected by sleep apnea are those in middle age, so 40s, 50s, 60s, and beyond. We generally worry most about treating sleep apnea in the patients in their 5th through 7th decades. A recent telephone survey by the National Sleep Foundation several years ago estimated that up to 25% of the adult middle-aged population likely suffers from sleep apnea. Only a small percentage of that population has been formally diagnosed with sleep apnea. Probably only about 5% of those who suffer from sleep apnea have been formally diagnosed with it. We actually did a study out of this sleep center several years ago looking at patients with various forms of cardiovascular disease, and we found that only a very small percentage of those patients were asked by their physicians whether or not they had signs or symptoms of sleep apnea. This means that the majority of the patients that we saw in our study asked their doctor about sleep apnea rather than having their doctor ask them. We know that treating sleep apnea has very important benefits for a variety of cardiovascular disease. We know that patients with hypertension who treat their sleep apnea often see improvement in their blood pressure, often to the point where they can reduce or eliminate some of the medication. We know that for patients with atrial fibrillation, which is a very common heart arrhythmia, that treating sleep apnea has a very important benefit in helping get the arrhythmia under control. We know that patients with cardiomyopathy or weakened heart muscle leading to congestive heart failure, in these individuals, if they treat the sleep apnea, they again see significant improvement in their cardiac function, often to the point where they can reduce or eliminate cardiac medications. There was a large study that was published about 5 years ago out of Europe looking at a large population, several thousand patients, all with coronary artery disease. Those individuals who were also diagnosed with sleep apnea did much better from a cardiac standpoint if they treated the apnea. The ones who did not treat the apnea went on to have a much higher incidence of additional coronary events, heart attacks, and death compared to those patients who treated their sleep apnea. When we talk about treating sleep apnea, there's often a variety of approaches that we take. First, we try to educate and counsel patients on things that they can do to help improve the sleep apnea. Often this relates to weight loss, avoiding alcohol or sedating medications, and looking for other secondary causes of sleep apnea, such as abnormal thyroid function. More specific treatments for sleep apnea include surgery, a dental treatment, and CPAP. Surgery is often limited in effectiveness for sleep apnea. Dental appliances may work better for milder patients with sleep apnea, and CPAP tends to be the gold standard or the best treatment available for treating underlying obstructive sleep apnea. CPAP is currently the best treatment available for sleep apnea, and CPAP stands for continuous positive airway pressure. What CPAP involves a air compressor, which is a small device the size of a clock radio, and then there's a hose that comes out of that device which delivers air pressure, sort of like a fan. And then at the end of the hose is a mask that's worn by the patient. And when the CPAP is on, air pressure comes from the device through the hose and through the mask down into the patient's throat, and it prevents the air passage from collapsing. And this is worn during the night, and it eliminates snoring and apnea, and typically greatly improves the quality of sleep as well. When patients require CPAP, it's crucial that their experience is a positive one, and it's been shown that patients' initial experience determines how well they do beyond that in terms of their success and compliance with CPAP. So this includes doing a attended CPAP titration with a registered sleep technologist, and also making sure that the mask is comfortable for the patient during that study. The majority of patients with sleep apnea feel sleepy and this interferes with their daytime functioning, neurocognitive functioning, mood, etc. When patients have their sleep apnea treated with CPAP, they often notice a significant improvement, both in terms of their subjective sleep quality overnight, but more importantly, how they feel during the day. They wake up feeling rested. They don't fall asleep repeatedly during the day. Their caffeine consumption often drops significantly. So patients often notice real subjective improvement when they treat their sleep apnea with CPAP. Weight gain is a significant risk factor for developing sleep apnea, and it relates to a buildup of the tissues around the air passage. So the same way that the waist increases and the rest of the body increases with weight gain, so too does the air passage in the throat, which is the key point that causes the obstruction which is behind obstructive sleep apnea. When they initiate treatment with CPAP, they regain a lot of energy which they didn't have, and this allows them to get back into exercise. A lot of patients with sleep apnea feel they are so exhausted that they don't have the energy to exercise, and it becomes a vicious cycle with reduced activity and increased weight gain. And when they start on CPAP, this cycle can be broken. They can start to exercise more and then lose the weight that they need to do. For patients with concern for underlying sleep apnea, I think it's very important to be evaluated and treated through a sleep center. Sleep centers tend to be staffed by sleep specialists who have specific expertise in all aspects of sleep medicine. We've done specialized training, we're board certified in sleep medicine, and we oversee the entire gamut of care from sleep testing to treatment. It's been shown that if you're treated by a sleep specialist through a sleep center, your outcomes tend to be better. We have a very high compliance rate with CPAP, a very high success rate. When you have a sleep study done through a sleep center, we try to recreate the home environment for sleeping, and patients tend to find this to be a very comfortable place to come for evaluation. Well, there are two areas that one would come to a sleep center for. One would be to get a clinical evaluation by a sleep specialist, and this would include going through your sleep history and then doing a detailed physical examination to determine whether a sleep study is then indicated. If so, then you would return to the sleep center at night for your sleep study. And the overnight sleep studies are done in private rooms, which are much like a hotel room. We try to make them very comfortable, and it's very similar to sleeping in a hotel room. During the sleep study, we monitor all of the different aspects of your sleep, including your breathing, your heart function, your oxygen level, muscle movements, etc. And we get an entire recording for the entire time that you sleep. We then analyze that to fully determine the quality of your sleep, whether there are any abnormalities outside the breathing, and then more specifically, we're able to document whether or not there is sleep apnea, and if so, how severe it is.
If you click on the link below, you can get more top answers about heart and sleep. All your questions are answered by a medical professional who specializes in sleep. Or simply call to request an appointment with our sleep centers to find out more about sleep disorders and how they're treated.